And welcome back. Now, infrastructure in some of Gauteng's public hospitals is in such disrepair that they would need expensive renovations in order to comply with the Occupational Health and Safety Act. A list of these facilities was revealed at a Provincial Legislature Health Committee meeting last week. And in addition, Gauteng MEC for Health, Dr Bandile Masuku, visited Jubilee Hospital in Hammanskraal yesterday after reports that that hospital had been without water for weeks. And Dr Masuku is here with us this morning to give us a bit of an update and also further insights into the situation in the province. Dr Masuku, thanks for coming through.
Thank you, and thank you for having us.
Let's first start by just, taking a quick shot at the state of the health facilities in Gauteng province. You visited Jubilee, maybe you can hone in on that, but overall, what is the situation like?
I think we've got a mixed state. We've got those hospitals and facilities which were historically for white population, which are somehow in a good state and somehow easy to keep up and almost clean. And then we have those who are historically who are serving the disadvantage in our townships and in our rural parts of our province, which are normally, when you know them, they are in disrepair, they are dilapidated, and they are pretty much very old, and outdated. So we are faced with a situation where we need to renew, and somehow in other places we have to rebuild new facilities, because if we have to look into the future of the NHI, we have to look into a future with proper and good facilities. So we are seeing a bit that we need to do some work to make sure that at least for now the service must continue. But I think in the long term and in the long run, we need to build a whole lot of new facilities.
How many facilities do we have overall in Gauteng, and how many of those are actually not compliant with the Health and Safety Act?
The Health and Safety Act, it is in two ways. There are those that have actually made the basics. I think they say the score is out of 5, and those ones have made out of 3. And I think most of them have been around the 3 mark. And we see that as a problem, because we normally have to treat both our staff and we also have to treat our patients. Basically, just to give you an example, that our facilities handle almost 28 million visits per annum, and which is a very huge amount of in number of people. And our facilities, we are now in the process of just doing the basics in terms of the maintenance. And we are going to start with the 10 priority hospitals just to make sure that we make them proper.
But how many of these hospitals are actually not compliant?
All of them. They are not really compliant. That's why I'm saying their mark is almost around 3. And we have started with the work. We are going to complete it by the end of this month. In December, we are hoping that we'll be having a good outcome with them.
That certainly doesn't paint a good picture, because if these facilities are not compliant, why then are they in operation? Because if we look at some of the other challenges that your department faces, which we'll talk to a little later on, it could speak directly to the fact that your facilities are not compliant.
Yeah, I think we have not been doing very well in terms of our infrastructure upkeep, and it's one of our priorities that we have made in our budget vote for the current year, that this is our priority. We need to make sure that we maintain them. Like I've said, our beginning and the start is just to make sure that they are compliant and they are able to occupy. The sad part with health facilities is it's not easy for them to say, let's shut them down and then we will see where we get the service.
Indeed, and just to bottom line this aspect of the conversation, what does the law say though? If these facilities are not compliant, what does the law say?
Usually they say we shouldn't be able to occupy them, and I think with the health facilities, there are those that we need to be able to say we can't leave a country or a province without health facilities. But as I've said, that we have a plan, and the plan has been underway. Repairs and those few maintenance issues that have been there are being actually sorted out. And mainly we're talking about signages, we're talking about exit signages, we're talking about the existence of committees. So it's a variety of things. It's not like the places are just falling apart.
And what is the plan? Because not only is this a vast amount of work, but it's also going to be rather costly, one would imagine. So what exactly is the plan to bring all of your facilities into compliant mode?
Like I've said, it's underway currently, and it's things that we're doing which are just basics, just to make that we meet the minimum requirements. And the plan, we are hoping that by end of this month, we'll be able to report to you back to say that all of them are meeting the basic minimum requirements. And then the major refurbishments will be starting around February, beginning of February next year.
So, as you've come into this portfolio now as MEC for Health in Gauteng, what would you say is your single biggest challenge? What would be your priority at this point?
My priority at the moment, it's my staff members. You know, I think we've inherited low staff morale in the department, and fatigued staff members, burnt out staff members. So we are focusing in just making sure that they are also motivated and they feel appreciated. Because sometimes when you listen to the news and listen to the radio and the comments from the public, they give you a sense that the public health in Gauteng has fallen apart. But I don't believe that, because when you say that, you are actually telling those who have been keeping up and working hard in the department and in our facilities, making sure that people are alive, people are vaccinated, babies are born, that you are saying that you don't recognize their work. So one of my priorities is just to make sure that we improve the staff morale, and then that on its own will translate into improved patient experience in our facilities.
Again, how do you plan on doing that? Because it is costing you. The court attached the department's accounts because of negligence payments, cases of negligence against the department amounting to more than R500 million.
Yeah, there's that thing, and we are working on that issue on medical negligence. And medical negligence, in some instances, yes, the court has found us guilty, but I think they've used wrong figures in terms of costing the actual damage and the cost, and we are working towards reducing the bill and the cost, in essence utilizing the costing that the public health sector would be. So we are going to reduce the bill. We are working hard in doing that. But all of it just remains that we have to deal with the staff morale. And the staff morale also talks about only the provision of the tools of trade and the equipment that is appropriate for our staff to use. So that in itself poses a severe problem, because this staff morale, if you look at the cases of serious adverse events against the Gauteng department and its staff members, if we run through that, Chris Hani Baragwanath Hospital, 1,763 cases. Steve Biko Hospital, 893 cases. George Mukari, 766. Charlotte Makleke, they had 722, and the list goes on. Yeah, I think we need to clarify that, because sometimes we tend to misunderstand what serious adverse events are.
Let's clarify.
Because people also equate serious adverse events as medical negligence, which is not the case. Like just a mere side effect when you react to a drug that has been given to you is also a serious side effect. It's a serious adverse event, and there are people who had serious adverse, like there's a Stevens-Johnson syndrome, which was a syndrome that we got with people who were using AZT, an ARV. And those we had to measure, whether we use AZT or we avoid, Stevens-Johnson syndrome. So serious adverse events must be understood in that context, that they are not necessarily medical negligence. It's just the things that happen unexpectedly on the treatment that we institute, whether it's surgery, whether it's medicines that we give, or something else. So
not necessarily, but it could also be as a result of, because as I was reading about it, it says these SAEs are largely arise from, and it states here, avoidable medical negligence.
No, that's what the people say. It's the issue when you look at it in an academic sense and what the definition is all about. It's not about negligence. It's not the same. When you take a drug, for an example, when your doctor gives you an antibiotic and you get a reaction on it, it doesn't mean that your doctor was negligent. It just means that maybe you should have been explained to well that there are some side effects that will come from the drug that you use. So we need to understand that. And these are things that even the scientists and everyone in the whole world are trying to reduce, because in essence, all the treatment that we institute might have an effect on something one way or another. The issue is that how we modulate and model our treatment to reduce that effect. The example I've made about SAT, it also causes anemia, but we had to make a call as medical practitioners whether we use SAT or not. But if we take it from the general statements that are made, it means the government was providing a drug that was causing anemia and it was unacceptable. But we saved lives, So we need to understand it in that context, because then there's nothing else that we can be able to do if we say nothing should be done.
77 of those cases referred for disciplinary hearings. Why? What happened in those 77 cases that warranted sanction?
Others, there are cases like, there which they're extreme and which I also disagree when people try to generalize that it's a general norm in the department, where there's overt negligence, where a person gets turned away from a clinic or turned away from a hospital without being checked or treated. And those are things that usually we frown upon. And the disciplinary process in this sense is not in a real sense punitive, because if we make it punitive, it will make it sure that others are not developed. We need to learn from these events, we need to learn from all what we do, and we need to be able to not repeat the same mistake again.
Moving on to something else, Tara Hospital, and against the backdrop of what happened with Life Esidimeni. And here you have a health facility catering for people with mental health disorders. Mm-hmm. And this hospital is understaffed, and apparently there's an absentee CEO at Tara Hospital. Can you talk to us about that situation?
I've noted that, I've heard about it, and we are dealing with it. It's a matter that is disturbing, that a person can take so many days off work. And we take the issue of management and leadership of our institution quite serious, because most of our institutions which don't have proper and concrete leadership usually are the ones that have serious problems. And I think it's something that as a department we are going to deal with, and we are going to give feedback to that regard. But the issue is that you can't have such a situation, and leadership is one of our big priorities moving forward.
What about the understaffing at this particular facility?
Understaffing, we've made inroads in terms of the adverts that we've put up, and we are continuously filling up all the critical posts that have been vacant. We had 1,974 across the province. We had an advert out, and applications are coming in, and people are being placed in their variety of facilities that they've applied for.
All right, just to wrap it up, time frames that you've set for yourself in order to resolve some of these matters.
Averagely, I'm working from a time frame of 2 years, because MECs in Gauteng, the average time is 2 years in the office. So I'm looking at that the first financial year that we're completing in March next year. Most of the things should be in place, and we should be moving from there. So when the 2 years end, half of the things that I've said should be done, they should be all ongoing.
And hopefully we'll come back and we'll take, stock of where you are at. Thank you so much for your time this morning. Gauteng MEC for Health Dr Bandile Masuku talking to us about the state of hospitals in Gauteng, as well as his visit to Jubilee Hospital in Hammanskraal, north of Pretoria yesterday.